A scenario is an interactive training workflow for nursing students. The titles and patient images are shown on the VSim main page. The student simply clicks on a scenario title to launch the workflow for that scenario. Each scenario includes a curriculum of pre- and post-simulation activities to prepare the student for simulation, to evaluate the patient care the student provides, and to provide feedback to the student. A learning plan or workflow for each scenario is presented in the following order: suggested reading, pre-simulation quiz, the VSim itself, a post-simulation quiz, a documentation assignment, as well as guided reflection questions. VSim for Nursing offers students the flexibility to complete the first three activities in a different order if desired. After the student has completed the VSim for one patient scenario at least once, the post-simulation activities in tab 4, 5, and 6 are unlocked and available for completion in any order. Additionally, activities can be performed multiple times to reinforce concepts in a learn-by-doing environment. Let's review each component in the workflow. When the student selects a patient scenario, the scenario workflow will open to the Suggested Readings tab. Suggested readings are recommended to prepare the student for a successful simulation experience. When the student selects a patient scenario, the scenario workflow will open to the Suggested Readings tab, which displays a patient introduction as well as a listing of suggested textbook pages and other resources that students should read prior to starting the simulation. Click on the green SmartSense link on the Suggested Reading screen to link to topics in Lippincott Advisor and Lippincott Procedures. SmartSense links throughout the activities provide references and direct links to trusted Walters Kluwer Health resources for further learning and remediation. For drug monographs, diagnostic test information, and basic nursing procedures, green SmartSense icons link to relevant topics in Lippincott Advisor and Lippincott Procedures, two current evidence-based point-of-care clinical decision-making resources used by practicing nurses. Wherever the icon appears, click on it to open the recommended reading. The pre-simulation quiz presents a series of questions prior to the simulation to assess the student's readiness to complete the patient scenario. The student clicks the Quiz Me button to begin. After answering each question, the student clicks Show Answer to see immediate feedback. References to the textbook or SmartSense links to appropriate Lippincott Advisor and Lippincott Procedures information are provided to help improve patient care performance during the simulation. Students may take the pre-simulation quiz as many times as they'd like, and the questions remain the same each time. The purpose of the pre-simulation quiz is to help students identify areas where they need remediation before working in the VSim, and it's not intended to serve as a high-stakes assessment. The VSim is the virtual clinical simulation which, when launched, allows the student to enter the patient's room and provide care to the patient by selecting actions in categories such as patient safety, communication, assessment, interventions, and medication administration. Actions, communications, and results are all recorded. Upon completion of the scenario, students receive personalized feedback on the actions that they've completed. Additionally, the feedback reviews key content and provides recommendations on areas where the student may need improvement. After reviewing the feedback log, the student can opt to repeat the simulation, do additional readings, or they can continue on to the post-simulation quiz by answering questions that test knowledge of concepts related to the completed scenario. The student clicks Quiz Me to begin and then clicks the arrows above the questions to progress through the questions. At the end of the quiz, the student clicks Submit and receives an answer key showing the answer he or she selected and the correct answer along with the rationale and reference for each question. Students can read more in the textbook pages referenced or click on the SmartSense link icons to read additional information from Lippincott Advisor or Lippincott Procedures. As with the pre-simulation quiz, students may take the post-simulation quiz as many times as they wish, and the questions remain the same each time. In the scenario workflow, the student clicks the Launch Simulation button on the third chevron tab to launch the virtual simulation in a new window. While the scenario loads, the student should read the patient introduction again to get important background information before he or she sees the patient. Tips for using the simulator are available on this screen as well. When the student is ready to begin, he or she clicks Go See This Patient. The virtual simulation starts with the patient's electronic health record, also known as the EHR. It opens for the user to review any available orders, active medications, and diagnostic results before seeing the patient. Tabs of the EHR that have information available at the beginning of the scenario will flash initially for the student. In addition to viewing information about your patient, it allows you to view test results, check providers' orders, verify medications administered, and review other pertinent patient information. Actions that are performed in the scenario are automatically recorded in the patient log, and medications are listed in the medication administration record, also known as the MAR. It is important to refer to the EHR throughout the scenario to help make the best clinical decisions. The EHR header contains basic information such as the patient's name, admitting diagnosis, height, weight, date of birth, gender, and allergies. The header remains visible throughout the patient's chart. There's also a minimize/maximize icon that's displayed when the mouse is hovered over the right edge of the EHR record. The close icon, identified by an X at the bottom of the screen, exits the EHR screen and returns you to the scenario. Here's a tip. Note that this EHR serves only to provide information during the simulation. This EHR is not Lippincott's DocuCare, which is an educational EHR where students can complete documentation assignments related to VSim for nursing scenarios. Upon entering the patient's room, the student assumes the role of the nurse and begins with an introduction to the patient. Patient responses are driven by the patient's condition and the student's actions and communication with that patient. The left side of the VSim screen displays the patient and nurse in a clinical setting. The right side of the screen displays the following action and communication menu tabs. The menus are displayed in a logical order influenced by the nursing process, with safety measures presented first, but the student can navigate to any menu at any time during the scenario. Click the desired menu to navigate to it. The bottom of the screen displays the following information, includes time, monitor, the electronic health record, call provider, and patient handoff. Simulation time is the time that's shown on the clock reflective of the current time in the scenario. Note that this is not the actual time at which the student is working in the VSim. It is a fictitious time. However, the user actions are monitored in real time, seconds, and minutes. Scenario time can be paused and or fast forwarded as desired. Simply hover over the patient or nurse in a scenario to access the control buttons. Use the left control to pause a scenario and use the right control to fast forward by 1 minute. Here's a tip. Each scenario will time out after 30 minutes if the user has not completed it. However, time during a pause is not counted during this time limit. If the scenario times out, the student will still receive a feedback log on the performance and they can retry again as desired. A search tool is displayed at the top of the menu. You can use the search feature to locate an action or assessment in the Actions and Communications menus. The Actions and Communication menu consists of tabbed options that are used to provide care to the patient. Let's review each of these options, their related submenu options, and the actions that can be performed in greater detail. Safety measures is the first menu option. To perform an action, click the safety measure icon. Once a safety measure has been selected, you cannot stop or undo the action. Communication. Actions related to communication allow the student to call for assistance from other clinicians or departments if the patient's condition changes or deteriorates. The student can also provide education to the patient and ask important questions relative to the patient's health and medical history in order to decide what interventions or actions to perform. The following actions are performed on the communications menu. They include call for assistance, educate the patient, or ask questions. The assessments menu contains all nursing assessment actions that can be performed on the patient. Within each category are numerous detailed assessments. To perform an assessment, click the icon for the assessment. In the role of the nurse, the student decides what assessments and interventions are most appropriate based on orders and the patient's needs. The actions that the student performs are automatically recorded and can be viewed on the patient log in the EHR and at the end of the scenario in the feedback log. The interventions menu contains groups of actions that can be performed when caring for the patient. The student determines the most appropriate action based on provider orders, assessment findings, and their nursing judgment. The Drugs and IV Management menu contains actions relating to administering drugs and managing IVs. The Test and Diagnostics contains actions related to diagnostic tests and radiology. Here's a tip. Remember how to manage continuous actions. To activate a continuous action such as oxygen administration, click the appropriate icon. The label on the icon automatically updates to active. To stop a continuous action, click the icon again. The label on the icon will be removed. Ending the simulation. When a student thinks that he or she has done everything for the patient, or to end the simulation for any other reason, click the patient handoff icon at the bottom of the scenario screen. An end scenario confirmation message is displayed. Click yes to end the scenario, and you are all set. In some scenarios, the student will receive a message to care for the patient a little longer if he or she attempts to end the scenario before certain critical events have occurred that are essential to the learning objectives. If the student attempts a patient handoff too early, this action may trigger events to advance in the scenario to avoid having the student wait. The student may also need to carry out additional provider orders to have the scenario progress in some cases. The VSim platform records each of the student's decisions and compares the student's performance against the performance of an expert. A numerical percentage score is calculated, and the student is presented with a summary of improvement opportunities categorized according to the following rubric. The impact of individual omitted or wrongly performed actions on the final score is influenced by the complexity of the individual case. Scores are provided to help track improvement and do not necessarily correspond to a letter grade. After ending the simulation, the student will be presented with a personalized feedback log, which outlines the actions taken with the patient, actions that the student should have completed, and a final score. The basic view of the feedback log provides a list of all actions taken or not taken. Main opportunities for improvement are displayed on the left side of the feedback screen. This section identifies up to 5 areas that need improvement. Scroll over the entries in this list to view the context in the log to the right. The detailed view provides the same list of actions but also includes patient physiology and assessment data. Incorrect actions or missed actions are tallied and used to determine the score, shown at the bottom of the feedback log. After reviewing the feedback log, the student can choose to do the following. Repeat the simulation by clicking the Retry button, do additional readings, or continue to the post-simulation assessment by clicking on the Continue button. Here's a tip. If the student retries a VSim clinical scenario, he or she will have the option to view past results for that scenario on the patient introduction screen. Note that this only provides quick access to past feedback logs for the selected VSim clinical scenario. Students should go to My Results from the main VSim for Nursing page to view results for the post-simulation quiz and for other scenarios. Our tech support team and customer success are there to help if you have any questions, issues, or in need of general technical help. Please contact tech support team by email at techsup@lww.com or by calling 1-800-468-1128 during the following available times. They are available Monday through Thursday, 8 a.m. till midnight Eastern, Friday from 8 a.m. to 7 p.m. Eastern, and Sunday from 4 p.m. to midnight, all Eastern Time. For additional training resources and student support, visit the Lippincott Customer Success page on The Point at thepoint.lww.com/student support. You can also download the Getting Started information sheets that can be found on this video page for future reference. Thank you and have a great day.